Okay, Assalamualaikum and hello. So my name is Muhammad AFZAN, and today I want to represent my group mate. So the first one is NADIA UMIRA, and the second one is NURALEEYA SHAFIQA, and then the third one is NURUL IDAYU ISDRIS. So we only us have 4 members in a group. This group have 3 people. Okay, thank you.
Very good morning to everyone. For today, I am your moderator for this talk show, NURUL IDAYU ISDRIS. Let me introduce our panels. Okay, for the first one, we have beautiful panel that always welcome, Miss NURALEEYA SHAFIQA. How are you today?
I'm fine, thank you. Hi everyone, my name is NURALEEYA SHAFIQA binti SAIM. And how are you, Miss Moderator? You look so energetic today for this talk show.
Same goes to you. For the second one, our gorgeous and smart panel, Miss NADIA UMIRA. You're dressed well for this talk show today.
Thank you, Miss Moderator. You look gorgeous in your dress. You dress well. Hi, my name is NADIA UMIRA binti DARMADI. I hope we can collaborate together.
I really appreciate your compliment, Miss Nadia. Thank you so much. And the last one, the only handsome man in our discussion for today, Mr. Muhammad SHAHRUL AFZAN.
Okay, thank you for the praise, Miss Moderator. You also beautiful for today. Hi, my name is Muhammad AFZAN bin BAHARI. Hope we can give some talk or for discussion today. Okay.
Okay, for today, we will highlight a topic that is quite interesting to discuss on. We want to make a discussion about COVID-19, which has become a hot issue lately. I'm sure that every one of us has our own opinion and thoughts with this topic. So, what is your opinion about this issue, Mr. AFZAN?
Okay, alright. Let me start first. The current COVID-19 crisis deeply impact women, men, girls, boys, and other genders differently. While men make up the majority of those who have died from the virus, women and girls bear the burden of disproportionate care burdens, disruptions and income of education, poor access to health and other essential service, greater risk to being disposed of land and property, and gender digital and pay gaps for women already living in poverty. This impact can be a shock to their economic stability overall and impede their ability to purchase critical necessities and such medicine and food.
Oh, like that. How about you, Miss Alia? Any explanation from you?
Thanks, Miss Moderator. I will give a simple explanation about what is COVID-19. COVID-19 is the infectious disease caused by coronavirus. Coronavirus was first identified in December 2019 in Wuhan, China. The World Health Organization, also known as WHO, gave a new official name to the coronavirus.
Oh, I see. Why are they called COVID-19? How can they get the name?
Oh, the head of the WHO, Tedros Adhanom Ghebreyesus, said the name chosen was COVID-19 as the abbreviations CO for corona, V for virus, and D stand for disease. That's why we call it COVID-19. What's about your opinion, Miss Nadia?
Yes, I truly agree with your statement, Miss Alia. Coronavirus has affected our day-to-day life.
this pandemic has affected millions of people who are either sick or are being killed due to the spread of this disease. Did you know that there are several factors that make us more risky for COVID-19? Like someone's age and gender. The old people like grandfather or grandmother can be at the highest risk to get this disease. Same goes for women. For the young people and men, the risk is not as high as the old people and women. Furthermore, poverty is also a factor of COVID-19. Okay, let's say people who live in a small house in a village and they are very poor. They don't have enough money to make a medical checkup or to buy a face mask or anything else. They will be exposed to this disease.
Oh, can I be interrupted?
Oh yes, of course you can. I also want to know more about this.
Thank you. I'd like to say that I want to highlight this point. Certain occupations are the factor of the disease, such as the doctors who always sacrifice their own life to rescue their patient's life. Even when the doctor does their work, they wear their special clothes. But it is not impossible for them to get this virus.
Oh, so same with the food rider, right? They were outside to deliver food to their customers. It is also not impossible to get this virus because they have met many people they don't know about. What is your opinion about this, Mr. AFZAN?
Okay, yes, that's true. Not only this, even pregnant women can be exposed to the disease. Other than that, some medical conditions are also a risk one. Next, crowding is also a factor to catch COVID-19. We don't know where or what other people do. For example, in the crowd, one person have COVID-19 and then he touched everything without using a sanitizer and also not wearing a face mask. So the chance for us to get the COVID-19 is highest. It is because we gather with this person who we didn't know their health conditions, so we better watch out for crowded places.
Wow, that's a lot of useful information. But I also wondering about the symptoms if someone catch this coronavirus.
Okay, it's okay. I can explain more about it to you. Based on the research, people who caught this virus mostly had prolonged fever and cough, which hurt the throat so much.
Not only that, Miss Nadia, there are more symptoms such as headache, rash on skin, or discoloration on finger or toes. It will make your head want to explode. There are less common symptoms. Other than that, there are few serious symptoms like difficulty to breathing or shortness of speech, shortness of breath, chest pain and loss of speech, or mobility or confusion. If you have one of these symptoms, you must go to hospital as soon as possible.
As I know, diarrhea is also one of the less common symptoms on COVID-19 patient, right?
Yes, absolutely. They will not feel well and keep going to the toilet because they feel hurt in their stomach. What do you think, Miss Nadia?
I think if you seek immediate medical attention if you have serious symptoms, make sure you always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home.
I'd like to remind you that on average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it also can take up to 14 days So be careful and stay healthy. Don't forget to use hand sanitizer before touching everything.
Alright, thank you for the reminder. Suddenly, some questions start in my mind. Is it true COVID-19 giving some effect to people?
Yes, of course. COVID-19 has affected day-to-day life and is slowing down the global economy. This pandemic has affected thousands of people who are either sick or are being killed due to the spread of this disease. Do you agree with me, Mr. AFZAN?
Yes, I totally agree with your statement. Not only that, COVID-19 also affect to the business and disrupt the world trade and movements. Identification of the disease at an early stage is vital to control the spread of virus because it very rapidly spread from person to person. We can see most of the countries have slowed down their manufacturing of the product. Presently, the impact of COVID-19 in daily life are extensive and have far-reaching consequences. This also prevents the entry of tourists and it restricts export and import activities.
I have the same idea with you, Mr. AFZAN. For your information, these can be divided into various categories such as healthcare and also social, except from economy that Mr. AFZAN has explained just now. Okay, the main category that we can see when COVID-19 hit us is healthcare. As the pandemic has begun to spread, there were many challenges in diagnosis, quarantine and treatment of suspect or confirmed cases. Besides that, our medical group had to bear the high burden of the functioning of the existing medical system. For the reason that happened is there are so many shortcomings in our medical system.
Yes, exactly, Miss Nadia. For the additional, COVID-19 has affected to many medical shops as the overloading that's occurred because the medical shops cannot provide medicine stock to cover all patients that caused by coronavirus. From the social aspect, COVID-19 has caused the service sector is not being able to provide their proper service. It's also made the disruptions of celebrations of cultural, religious and festive events. And there is a change from the normal norm to the new one. We also cannot deny that undue pressure among the populations increased.
Thank you, Miss Nadia. That was a great point to be said. So, Miss Nadia, how about the effect COVID-19 of online learning on our children? Do you agree with online learning?
Here are some of my points of view. I absolutely do not agree with this online learning. The sudden shift to online learning due to a pandemic, which is without any planning specifically in our country, can lead to a lot of negative effects. Today, I'm going to share with you guys some of it, such as it can lead to passive learning and risk of the lagging behind academically by students. Okay, this is because certain students who suffer to understand some subject through online education, and that's why they refer face-to-face in class.
Oh yeah, other than that, as parents, we won't believe there are also bad effects that had been facing by our teaching staff, such as unready teachers for online education and the changing format of students recruitment. That's all. Thank you.
We heard the issue about the examination that has been postponed by the pandemic of COVID-19 recently. This involved millions of students or more who have to face challenge ahead of the exam, especially to the SPM candidates. I can imagine how struggle they face the challenge in COVID-19 era, and they were stuck in their study since they were in Form 4, and I believe that they were the best to be chosen to face all of this, and I'm so proud to hear that most of them were success in their examination with flying in color.
Yes, I think they started to realize that they cannot to stay in their comfort zone, as they have to find the new solution. From my opinion, even mostly of them were through it successfully, but still they were certain of the student that affected by mental illness, they can't handle the pressure they put on their learning.
Yes, good explanation, Mr. Afzan.
Pardon me, I want to ask about something we should do when we catch this virus. Absolutely, we don't want our beloved person get the same disease, right? Can you answer this, Miss Nadia?
Yep, absolutely. There are more things we should do if we caught COVID-19, such as maintaining a safe distance from others, at least 1 meter, even if we don't know if they are sick or not. Second, we must wear a face mask in public, especially when we are indoors or at outdoor. When physical contact are possible, we must have a social distance.
I would like to add some points. To avoid this virus, we must take care of ourselves first. After exposure to someone who has COVID-19, we must cooperate with contact tracing procedures to stop the spread of the virus. Furthermore, we need to call healthcare provider or COVID-19 hotline to find out where and when to get a test. If testing is not available, stay home and away from others for 40 days.
Yes, I totally agree with that. While you are in quarantine, make sure you don't go to work, to school, or to public places. Ask someone to bring you supplies. Yeah.
I like to add some ideas from me.
Okay.
Make sure to use hand sanitizer frequently and try to stay in a separate room from other family members to keep the room well ventilated. And then don't forget to always monitor yourself for any symptoms for 14 days. If you feel the symptoms, you can call your healthcare provider immediately. If you have any of these danger signs, such as difficulty breathing, loss of speech or mobility, confusion or chest pain, don't forget to stay positive by keeping in touch with loved ones by phone.
If there is a problem, then there must be solution, right? So, is there a ways to overcome COVID-19?
Let me answer that. Of course, there must be solutions. First, we need to maintain a safe distance from others, at least 1 meter. I think everyone knows this,
Yes.
although they don't appear to be sick. Next, we must always wear a face mask in public. This face mask, okay? Also, clean your hands often. Use soap and water and alcohol-based hand rub. Don't forget to get vaccinated when your turn. Follow local guidance about vaccination.
Yeah, also you must cover your nose and mouth with your bed elbow like this, or a tissue when you cough or sneeze. Stay home if you feel unwell.
And then, if you have fever, cough, and difficulty breathing, seek medical attention. You can call in advance so your healthcare provider can direct you to the right health facility. This will protect you and prevent the spread of virus and other infections.
Yes, also properly fitted mask can help prevent the spread of the virus from the person wearing the mask to others.
Yes, I agree with you. Masks alone do not protect against COVID-19 and should be combined with physical distancing and hand hygiene.
So, we got some questions from audience. The first question is, my friend is traveling to a country with a case of COVID-19. When they return, do they have to isolate themselves?
Can I answer this question?
Yes.
Okay, for me, that's a really nice question to be answered. So my answer is so simple. First, they will be screened at the international gate of Malaysia. If a fever is detected with symptoms of a respiratory infection, and then they will be referred to a health facility for further examination. And if they are healthy and have no symptoms, they will be given a home assessment tool and a health alert card. They are advised to stay at home and need to monitor their health for I think 2 weeks. And if you have symptoms, immediately seek treatment at a health facility by bringing along the health alert card that has been given. Okay, that's all that I can explain so far.
Thank you, Miss Nadia,
Yes.
for the answer. Next question, Miss Alia. What do you think of them who don't want to take vaccine?
Okay, thank you, Miss Moderator, for these questions. Alright, I will answer the question excellently. For your information, they cannot enter any place, nor are they allowed to participate in organized events, and they cannot shop. Every individual who wants to get into a place needs to have a vaccine certificate to enter the place. Therefore, they should take the vaccine to facilitate the course of their life.
Alright, Q&A session has ended. So, the only handsome man and intelligent man in our discussion for today, Mr. AFZAN, what conclusion can you tell us about this COVID-19?
Okay, thank you for the praise. Basically, from our discussion today, the conclusion that I can talk about is that we all have been affected by the current COVID-19 pandemic. However, the impact of the pandemic and its consequences are felt differently depending on our status as individuals and as members of society. While some try to adapt to working online, homeschooling their children, and ordering food via Instacart, others have no choice but to expose to the virus while keeping society functioning. Our different social identities and the social groups belong to determine our inclusion within society and by extension our vulnerability. I'm sorry, I think it's vulnerability to epidemics. COVID-19 is killing people on a large scale, so watch out and stay healthy.
Finally, we have come to the end of our talk show where we have shared a lot of knowledge which we didn't even know before. Well, from what all our panelists shared just now, there are good things that you must take seriously. So, it is everyone's right to choose how to deal with it. So, that's all for this talk show for today. Hope you guys stay positive and healthy all the time. Don't forget to use hand sanitizer and always keep your distancing.
Bye.
Kali ni macam
Okay. Oh, baru jawab aku.
Ayah, tengok ni. Alright. Q&A
Session.
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 Sebentar.